What exactly is a heart attack, Dr. Thompson? What is going on physically?
Well, you know, our heart is a very interesting organ. In the normal human, if you take your fist and wrap your other hand around it,
Okay.
that's about the size of your heart. So if you're 7 feet tall and have big hands, you have a bigger heart than if you're shorter. And that heart is basically a pump. And the average human has about 60,000 miles of blood vessels and about 5 quarts of fluid, blood. And that little gizmo, that little heart, circulates that 5 quarts through that 60,000 miles about 1,500 times a day. So it's really an efficient little pump.
Genius.
Yes, it is. It really is. And basically the heart has 3 main components. One is the actual structure of the heart. It's mostly muscle, and it has 4 chambers and 4 valves. But structurally, it has this fibrous tissue that makes up the chambers and the valves, and then everything is encased in muscle. And obviously, the star of the show is the muscle to pump all that fluid through all those miles of blood vessels every day, 100 to 115,000 beats a day. Busy little operation in there. So the way it does that is it has a rate switch, its own internal pacemaker, and its own little wiring system to tell the muscle how to beat and to beat rhythmically. And so it all runs real smooth. Now, the coronary arteries bring blood to the muscle. This muscle is obviously working very, very hard to pump this fluid and needs oxygen and other nutrients, glucose, amino acids, from our body to use as fuel for all of this beating, the contracting that these muscle fibers do. And then there are waste products, carbon dioxide, urea, nitrogen, and other things that that those cells have to get rid of, so it dumps those into the coronary veins. But a heart attack involves the coronary arteries. These arteries that bring the blood to the heart muscle, the cardiac muscle, have a lining in them that is very, very smooth. It's called the intima, or the endothelium, and it's a very smooth lining. And the reason it's smooth is blood tends to clot on a rough surface.
Oh,
so
like when you have a wound.
Right, if you have a wound. If you cut yourself slicing an apple with a kitchen knife, you transect across the artery, then the artery is no longer a smooth surface because it's been cut, and that trips what we call the clotting mechanism, and the blood platelets stick together, and bingo, you form a clot that totally occludes the blood vessel, so you quit bleeding. And it's a wonderful thing. And unless we have hemophilia, that works like clockwork, literally probably millions of times in our lifetime that we get cuts and scrapes and we bleed a little bit and it stops. So clotting in and of itself is a wonderful thing. Good thing. Now, in the coronary arteries, if we have plaque buildup, fatty deposits of cholesterol, this lipid plaque, it gets deposited underneath the lining of this very smooth chamber. And what happens then is you have a rough surface. And we already talked about the blood is programmed to clot on a rough surface. So the rougher the surface in the artery, the more likely a clot will form. And when a clot forms in the coronary vessel, just like in the tiny blood vessel of our finger, the clot grows quickly, totally occluding the blood vessel to stop the blood flow. And when we stop the blood flow in a little vessel in our finger, the bleeding stops because the blood flow stops. But when we stop the blood flow in the coronary artery, the part of the heart muscle that received that blood, the oxygen and the other nutrients, now gets nothing. So the heart muscle starts to deteriorate, decay, and die. And that's what causes the pain. And some people don't have any pain because our heart muscle, like I said, we're beating 115,000 times a day. We're oblivious to it. Our nervous system doesn't tell us what our heart is doing. So some people when they have a heart attack, their nervous system doesn't give them warning. But whether you feel it or not, the event is the same. The artery is now occluded with a clot, and the part of the muscle that got blood from that artery gets no blood, and the muscle will decay. And what happens when we have a heart attack, sometimes that messes up the pacemaker and the little electrical circuits, and that acute lack of blood flow causes fibrillation and sudden cardiac death. But in the long term, what happens is that that muscle decays, just like if you have a bad scrape on your skin, you'll get a scar. Well, the heart muscle will be scarred, and scarred tissue can't pump.
Okay.
So individuals who have a large heart attack or a series of small ones where the muscle has been irritated, and if they don't die from the acute event, the arrhythmia, they may have a very weak heart muscle that can't circulate all that fluid as well and get a condition called congestive heart failure, and that can be very disabling. So that's the long version of what a heart attack is.
Well, thank you for explaining that.
You bet.